Sure. Hi, I'm Dr. Maria Sampalis. I practice in Cranston, Rhode Island. I own a practice now that's grown three times growth since I bought it 6 years ago. So I'm very proud of that, and I've kind of done that different ways, outside the box thinking over the years. Very happy to kind of share my experience to kind of help optometrists in the industry learn how to do things differently instead of kind of following what the norm is. So August is back to school here in Rhode Island. So that is something that I do target, and I do talk with the team about and how to target those patients. I see a lot of elderly patients. I tell them about myopia management for their grandchildren. I tell all the adults that I see, even if they don't have kids, nieces, nephews, let them know about myopia management. That has been the strategy for back to school recently. That has been a way to differentiate my practice and grow it, and it's been very profitable as well. And families come from there. Word of mouth referrals come from that because it's the latest and greatest.
So, with the prevalence of myopia, especially pediatric myopia, growing, what is your approach to at least build awareness within your patients and that parent education?
So what I've done in the practice, I've done e-blasts and letting patients know about that, the new things that have come out. When my site came out a long time ago, did an e-blast style. Same thing with the new lenses and new technology that we have, and specialty contact lenses as well, like Ortho K. Those have been things. I don't do a lot on it, but I have those options for those patients, and I utilize the vendors to really help me on that. I am not an expert. But you don't need to be an expert on these things. We have a lot of resources out there that can help troubleshoot and give us those things. These technologies really create loyalty in the practice, keep patients coming back. They're not able to kind of, use it as a commodity, go online, buy things like that online. So this is way that you kind of describe myopia as a disease, and I explain myopia as a disease and have an illustration of what their eyes will look like at 65 with increase in retinal detachment, cataracts, glaucoma. Those visuals have been important as well. We have it throughout the exam lanes. I have 4 lanes and different lanes, and that's something that comes up, and they can look at that as well. I do have pamphlets in the waiting room. Those have been things that they can look while they wait, even though they don't really wait in my practice. That has been something that patients really appreciate, respecting their time and convenience.
You've mentioned a couple times of building that patient loyalty, especially for these new patients that you're seeing. Do you have any tips for optometrists? We know whether they have a budding practice or they want to build that patient loyalty, have their patients coming back frequently. What tips do you have to at least ensure that a little bit more?
I got some great advice from an older optometrist. She ended up being my friend mentor recently, and she said, Maria, I have a great patient base. I felt you just take care of the patient, do what's right for the patient, and the business will grow, it'll follow. And it's great. You just do what's good for the patient. You don't pressure them to buy glasses. You don't pressure them to do anything. You take care of them, you answer their questions, and you do a great exam, and your practice grows. We get a lot of word of mouth referrals that way. That's the patients that I want in my practice, the ones that value their eyes, the ones that care about health, their eyes. Those are things like that. And we do focus on materials and growing that part of my business because it is a big part of our business. Optometry business, about 60-70% of that. But the medical model has been a great way now with, downturn in the recession to keep growing the practice. And loyalty with the medical model is a big way, but taking care of the patients and explaining things. Technology, something so simple as a retinal camera can really help create that loyalty, and just patient education, I think, is important. And talking to the patient, making sure that you explain things that they can understand, and also that personal trait. Kind of talk about what you did on the weekend. Talk about your kids, things like that. It's something small, but you develop relationships. I've been seeing some of these patients for almost 20 years now. I feel like we're friends. So these are things that I think have created loyalty in the practice. And where I started a long time ago. I'm not where I am now. I mean, I've really grown, but I've appreciated those patients that supported me when I really needed the support. And patients have followed patients over the years, so they've supported me. So I really want to support them and give them good quality care.
Do you have any patients that generationally have seen you over time, and how are you able to build that, from seeing a patient from a child into adulthood?
Yes, I did have someone on Friday that I was seeing for a long time, and now he's getting married and having a baby. And it just makes me feel old now, right? So, I've just been seeing him. He's been routine exam, needs contacts, but it's been great to kind of know these people and because they've been asking me when I first started, I was pregnant, and now they ask how old the baby is now, and the baby's 13 years old. So, it's nice to kind of build those relationships, and you have that. And then so, sometimes I'm just walking around the neighborhood on the main street and, exercising, and you have patients stopping and saying hello. And it's just that community, right, that we build. You see them in the supermarket and things like that. So it's not just a dog, it's a bigger relationship. It's community, it's lifelong. And, patients that have, certain businesses, I kind of utilize them too, to support them as well. I think that's what small businesses can do is kind of support each other.
You had mentioned previously about the profitability piece of frames and contact lenses. How is that approach to maybe the first time contact lens fitting or first time buying a frame for a child? How is that approach in sale different than an adult?
We have to make sure that they fit right, they look good, that they understand what they're getting. Some kids are excited about it. It's not like it used to be with glasses. And some, find it as something that they don't want to do. They don't want to wear. They might be made fun of at school. So, kind of that positive approach. Sometimes I'll come into the optical and give my opinion and how they look and what make sure that they're good quality and sturdy because if it is a first time purchase for that family, we want to make sure that we give them good quality so they're not coming back and discouraged with that. Because a lot of times they have misconceptions on things. Sometimes things are cheaper for a reason, is what I tell them. We want to give them good quality, look good, and then also explain the lens options with the blue blockers, with the myopia management lenses, things like that as well, to so they understand. And polarized glasses or transition lenses to protect their eyes from the sun.
Anything else you want to add on back to school that we haven't touched on yet?
No, back to school is a great opportunity. I mean, even if you don't have a lot of kids, I mean, it's just educating, grandparents that you see, the elderly population, because they have grandkids. They have people they talk to, right? Word of mouth is very big. So just doing what you're supposed to do, just being a good doctor, kind of focusing on taking care of the patient. A lot of things will really follow. I know we have a lot of things in eye care that kind of disrupts profitability. And we could do a whole podcast, an hour on that. But again, just going back to the basics, doing what you do as a doctor, taking care of the patient, developing those connections really can help grow your practice and profitability as well. And just trying to keep things lean. It is okay as an optometrist if you have to do sometimes a seg height, if you have to help in the optical, if some days you don't have a tech to keep it lean. You don't need all those things. There are days over the years I used to do all that stuff. Now the practice has grown, I can kind of delegate, but I still know how to do that. So if we are short staff or there's staff turnover, we continue to grow. And it just makes you a better doctor and business owner as well. And the staff will know too, if you're able to do all these things that you're not really reliant on them too. So you kind of control the business as well.